The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Atcha. Dr. Atcha, welcome to the program.
Thank you, Randy. Pleasure being here.
All right. Now, before we get into today's topic, tell me a little bit about your practice. We invited you to talk about dental implants.
Sure.
Brought a lot of photos, by the way. Some of these are pretty gruesome photos, by the way. But and you brought models. What are the different types of procedures you do at your office?
Sure. Randy, we have a very unique practice. Actually, we have a unique practice in the sense that, I have a general practice. I have a large general practice with 3 doctors, and we do all kinds of procedures.
Where in Chicago are you, by the way?
I am in Dyer, Indiana, which is 20 minutes from downtown Chicago, but still considered a suburb of Chicago.
All right, all right.
We see patients from all walks of life, from children to to teenagers to adults to seniors. We do root canals, we do crowns, we do bridges, but my passion, my focus in the practice is dental implants.
You like dental implants.
I love dental implants.
A lot off camera, things like that. Then your training went to LVI, trained under, I guess, this Paulo guy, whoever he is, like the godfather of dental implants.
Yes.
So you've put a lot of training into dental implants. So what's changed? Why is it that what used to take like 9 months to get dental implants now can be a few visits? I mean, what's different? What's changed?
Sure. A lot has changed, Randy. What's changed is the way we do implant dentistry. To me, implant dentistry is the best thing that happened to dentistry.
Really?
It reconnects people to something that they've lost. Okay.
All right.
And what they've lost is a tooth. Okay. A lot of times, we take, we take our eyesight, our hearing, and not only our hearing, we take our teeth for granted until they're lost, and they're really, really missed sorely. When I get patients from either one tooth missing, a few teeth missing, or all their teeth missing, their common complaint is that they can't eat, they can't smile, they can't chew. So yes, dental implants do reconnect people with something that they've lost.
Now, you've had extensive training,
yes.
You say, with dental implants.
Yes.
Tell me about it.
Randy, I've restored implants when I got out of dental school, but my real training started in the last 5 to 7 years, where I've sought the best mentors in the field of implant dentistry.
Okay. You even went out of the country to learn that?
I went out of the country too. I went all over the world. Absolutely. I went all over the world to learn what I wanted to learn so I can bring it back to my patients and enhance their quality of life.
Okay, so you do the surgical part
Yes.
of dental implants, and you put the tooth on top, but that's not how it's normally done. Is that right?
That's correct. The traditional model is where a patient either goes to a periodontist or an oral surgeon and gets their implant placed, and then they have to drive all the way across town to their general dentist or the prosthodontist to have a tooth put on. There's nothing wrong with that concept, but I realized that it created a lot of confusion for the patients. Different fees for the dentist, different fees for the surgeon. Patients want convenience, and patient wants it all in one facility.
Is it true they still don't like going to the dentist, right?
They don't. Patients don't like going to the dentist.
Do you hear that, by the way?
I hear it every day.
What do they say to you?
Say, Doc, nothing personal, but I don't want to be here.
Really?
I hear it all the time. But we make a joke out of it. I say, you know what? I don't like patients.
You do say that's funny.
Yeah,
okay.
but it's funny. So we break the ice. But the patients like patients like this model better is because they don't have to go all over town for their care. They can have.
You even have a CT scanner.
Right. I invested in a CT scanner because it allows me. Because when we do so many dental implants, it's better whether you do one tooth, few teeth, or all teeth missing. It's better because I know exactly in 3-dimensional where my patient's anatomy is like. I know where the nerves are. I know where the sinuses are, and I don't have to play guessing game like I did with the conventional Panorac.
So how is it, though, that what used to take you 9 months now can be done, in a few visits, as far as, dental implants?
Sure. Well, one is definitely with imaging. With 3D imaging, we know exactly what we see in patient's mouth. It's a one-to-one. What we see in patient's mouth is what we see on a scan. So it guides our implant placement very, very accurately. We know where the vital anatomy, the sinuses, the nerves are. So there's no guessing game.
Okay.
Secondly, with different methods, we are able to different methods and different types of implant design. Implant design have evolved so that way we are, what used to be that we have to wait for the bone to heal and then place teeth on. Now we can take out a tooth, place implants, pack a little bone around it, and put a tooth on or teeth on immediately.
And they can eat?
And they can
right
eat soft. Absolutely, they can eat softer foods. There's some restrictions, but the best part about it is that, you know, in these days, Randy, everybody wants immediate gratification. You know?
Okay.
So immediate placement of dental implants is a very advanced but a very revolutionary concept that when patients can walk in our office with a bad tooth or missing tooth.